Namaste. I'm Dr. Shwetha Anand. I'm a fertility consultant having more than 15 years of practice and plenty of IVF cycles to my credit. I practice in Janisthaa Fertility Center, which is situated in Basaveshwar, Nagar, Bengaluru. Removal of uterus, we call it as hysterectomy. Uterus has to be removed when it is absolutely indicated. What I mean by absolute indication is, removal of uterus in 30s is generally not advocated because it decreases the blood supply to the ovaries and you might have early menopause. Saying so, we should not remove the uterus unnecessarily. So when is it that we remove the uterus when you are in 30s? Especially when you are having excessive bleeding, not controlled by any methods, maybe by hormonal method or by mirena or by hysteroscopic resection. If nothing is working, that is when you have to get hysterectomy done. What I mean by having excessive bleeding is that if you're having too much of clots passage during the cycles, so much so that your hemoglobin starts to decrease or it starts to affect your day-to-day activity, this is when you have to get hysterectomy done. Sometimes what happens is, in a very rare situation, people might end up with cancer of uterus. So this is also indicated. If you're in your 30s, you have to get the uterus removal because of the presence of cancer. Very rare situations because of infection, the pelvic inflammatory disease, if it is not controlled and if it is life-threatening, that is when we'll have to remove the uterus. Otherwise, removal of uterus in your 30s is generally not indicated. And it is very common when you're reaching about say 40 or 50, when you have difficulty in controlling the bleeding. That is when uterine removal is advised.